ahead and open up the doors to our live Zoom. Folks, if you are out anywhere watching this on the live stream or even the replay and you would like to join us live, you may join us by going to dailywithdoczoom.com Wednesday, Thursday, Friday from 12 to 1 p.m. Pacific time. So that is 12 to 1 Pacific 12 to 1 Pacific time, p.m. So in the afternoon, lunch hour, which is super awesome for those of you who are listening to us on KSCO during the lunch hour or on your drive home at 6 p.m. KOMY. So we're so excited to be able to have us not only on Facebook, Twitter, which is now X, YouTube, Rumble, Patreon, Apple TV, Fire TV, and Roku. We are also still on the radio. So, folks, if you have a radio station that you would love to hear our program on, we can get a syndication sent out to that radio program. Get in contact with the radio program manager and have them reach out to me at DailywithDoc.com through that contact option. I'll make sure that we get them all the information they need so we can get them set up and airing this information as well. And this also goes with those who are on the different platforms with their own podcast. We are honored to be able to bring to you the information that we have on our program to others as well. So again, go to dailywithdoc.com, use that contact option, reach out to me, and we'll make sure that we offer to all that are seeking the truth information in getting it out there on their programs as well. And not only as a podcaster can you offer the information, but we also have the opportunity to create an additional income stream for you as you are spreading the news. We want to give you a thank you check for doing so, and that allows anyone that clicks on your links to make their purchases, get exactly what they need in order to support an optimal health journey, meeting them where they're at, and you get a thank you check for promoting the information and sharing with others. So I think it's kind of a win-win, Dr. Wallach. Here on Daily with Doc, we are a resource for an amazing group of people who are health enthusiasts, even medical professionals, certified holistic health coaches. So if you were invited by somebody specific, make sure that you get back with them and let them know what you liked best about the program. If you asked a question, remember the date, take that date to the person that referred you and said, hey, I asked a question. Dr. Wallach, he gave me exactly what I needed to take, but I need your help to get the products. So make sure that you get back with the person who shared this program with you. If there's no one to thank, you are more than welcome to call my call team at 855-949-3377. Again, that's 855-949-3377 in order to reach one of the Daily with Doc coaches. And if you would prefer to do email, you can also go to dailywithdoc.com. Click on that contact option in the menu and reach out via email. Now, another great thing about the Daily with Doc, and this is available to everybody, is we have that good foods, bad foods list that you're going to be hearing about on today's program. So make sure that you go grab that, bookmark the page, or print it out, however it is that you're able to access information easily, so that as you're going shopping, you can focus on those good foods and leave those bad foods out of the cart. So without further ado, my name is Becca Dukes. As the hostess of this program, I am also the Director of Student Services for the Institute of Holistic Health, where we teach about the 4 areas of health, how they're affected by nutritional deficiencies, and then using Dr. Wallach's research and also the formulas that he and his team have come up with as solutions to helping people regain their health. And today we're going to be talking about mental health with a doctor who I think is absolutely a great person to do so, because he himself came over some mental challenges as a child and went on to be a very great individual who has helped more people than I know find the answers when nobody else can tell them what's wrong with them through nutrition. Dr. Joel Wallach, he has a Bachelor of Science in Agriculture, both in plant and soil studies. He has a Doctor of Veterinary Medicine, where he was helping animals around the world that couldn't tell him what was wrong, but he figured it out because as he was working through college, he was in the pathology lab figuring stuff out, including finding for a massive die-off due to pollution that affected the body because of the nutritional or the lack of nutrition that was being caused because of that pollution, or an overabundance of something that should not be there, which actually, folks, is found very common in today's stores in the foods that have been approved for us to eat. So pay attention, because this gentleman has almost 30,000 autopsies under his belt, who has also found the cause of, or the first case of, a non-human cystic fibrosis, including the cause of it and also the solution, which then he put into the formulas and clinical, and just has done some amazing things as he was teaching nutrition at the college level, and then decided, hey, why not become a doctor that I can actually legally treat humans and make recommendations for them as well. So he became a naturopathic physician, and today we are honored to be able to present him his work and his everything packed in that beautiful brain to you, the empowered individual. So, Dr. Joel Wallach, I just want to add you here to the screen with me, and thank you so much for all that you have done for all of us. And it started with helping yourself.
Well, thank you, Rebecca, and thank you, team, for everybody who's on with us today and everybody who's on with us off and on throughout the days and the weeks and the years. And we're moving forward. And like I say, how close are we to finishing this project that we want to get out?
Dr. Wallach, you keep asking me, and I keep telling you it's going to be this week. So,
Okay, we've only got 3 days left this week, 2.5 days.
well, I know, but if you stop giving me additional projects to work on, then I'll be able to focus on just one at a time and get them all done. No?
No, I want to finish this one big project right now.
All
Okay,
right.
okay. So with that said, what we want to talk about today
Is mental health.
okay, we're going to talk about mental health. And this has a little bit to do with this big project we have, so we're not going to touch on that part yet. But you have to appreciate, and we have several people, we are very famous. I know we want to talk about Danny Glover. He was born with seizures and epilepsy and all that kind of stuff. And by the time he was, he was a professional actor, comedian, very, very talented person, but he could be on the stage talking about something and go into a seizure. Okay. And so we actually figured out what to do for him with the Healthy Brain and Heart Pack. And he came back and he has just gone around the world telling his story and helping so many people. So we cannot thank Danny Glover enough. Okay. And his story is part of this big story that's coming out here pretty soon, this week yet, Rebecca says. And she's been working day and night working on that, I know. And one more I want to talk about just briefly is Dr. Mike Freeman, okay, from Maryland, pastor. And he was in a coma for, I don't know, 2.5, 3 months, and being fed IV and G tubes, that kind of stuff. And I get a call, okay, from one of our great distributors for the longevity up there, Linda Tyler. And she said they're pulling the plugs on Pastor Mike, and they're saying he's only got hours or minutes to live. Anything we can do for him? Well, does he have a G tube? No, they pulled that. Does he have an IV? No, they pulled that. Okay, do you have any the plant-derived minerals? I got 3 quarts in my car right now, okay? Get them. put a half a teacup of the plant-derived colloidal minerals, okay, on his chest, on his upper belly, lower belly, on his back, between his shoulder blades, his middle back and lower back, 3 times a day. And then let's talk in a couple of days or so. She calls me the next day. Linda calls me the next day and said, Doc, you're not going to believe this. Pastor Mike woke up this morning and he's perfectly normal after this 2.5, 3 months in the coma. They said he's going to die in a few minutes. And what a wonderful story. Well, that was 10 years ago, and he still goes around the world lecturing and telling his story. Just rubbing the plant minerals on his skin, absorbing them through his skin, resolves his problem. Okay. And so these are great stories, and these are just a few of the stories we have. Theo Ratliff, a great basketball player, he lost his position because they wanted to do a double knee replacement on him, artificial knees. He didn't want to do that, so he quit basketball. And Mike Glenn, the Stinger, another basketball star who had problems, who he had fixed, brought Theo Ratliff to us. We built the Healthy Bone and Joint Pack for him, and we actually made the glucogel for him. Okay. And in 3 months, he came back and he played for 9 years, made $100 million on contract. And so he's been running around the world telling his story, okay, of how these nutrients helped him. Okay. Now, I could go down this list. I'll give you one female here, Kelly Herron, basketball star from the University of Tennessee. And she was an All-American women's basketball star, but she had a shoulder problem. She came to one of our meetings because she heard us talking on the radio. We didn't know her. She had not been using our product. So we got her on the things that we made for Theo Ratliff, the Healthy Bone and Joint Pack, okay, and the Rebound Sports Drink. And that was like in May and June, okay? And by September, she's ready to go again. She played for 2 more years as an All-American. She played for 4 years, okay, with professional women's basketball. And so it was really, really a great story with Kelly Herron. And all these pictures are in this flip chart, okay? They're in the flip chart. And one of the things we have to talk about is symptoms of osteoporosis of the skull, symptoms of things going on with the brain and spinal cord. Okay, this is one of my favorite pictures.
Oh.
Yeah.
All right, I'll get that up, Doc.
Okay, yeah, the top one is osteoporosis, or is a normal skull. The top one is a normal skull, 1/4 of an inch thick. The bottom one is osteoporosis of the skull. It's 1.5 inches to 2 inches thick. Actually, well, you're not going to find it.
Well, I am going to find it, except for you gave one of my books away, so now I have to open up my spare.
Okay.
But as you'll see, Dr. Wallach is showing up, holding up the book. It's All in Your Head, which also has some of the clips from it in the flip chart that he mentioned, the Dr. Wallach's 90 for Life crusade to save humanity and the world. And here we go. I got it for you. You go ahead and talk, Doc.
Okay, thank you. There you go. There you go. A little higher. There you got it. Top one is a normal skull, 1/4 of an inch thick. The bottom one is osteoporosis of the skull. And you get the book, it's all in your head. And each cranial nerve, each of the 12 pairs of cranial nerves is a chapter. It tells you all the diseases and symptoms you get when they get squeezed by osteoporosis of the skull. And same way with the spinal cord. There's a CD that goes along with that. So make sure you get the CD as well as the book, because the CD does most of the spinal cord stuff. Okay. Now, when you have symptoms of osteoporosis of the skull, we're talking about persistent or sudden onset headaches. Headaches that changes or is different parts of the brain. Pain in the face, okay, loss of feeling or tingling, loss of sight or double vision, loss of the sense of smell, changes in the bladder and bowel function, slow digestion, vertigo, balance problems, hiccups, loss of the sense of taste, loss of the gag reflex and the ability to swallow, slurred or impaired speech, ringing in the ears, loss of hearing, abnormal heart rate, prostate issues, back pain, radiation to the feet, toes, or other parts of the body. This is dealing with osteoporosis of the skull, squeezing the spinal cord and the 12 pairs of cranial nerves, loss of the range of motion, muscle stiffness and spasms, muscle rigidity, weakness or loss of muscle strength, And you go to chiropractors, you go to medical doctors, you go to all these people, but they don't deal with the nutritional part of this. Okay. Now, when you talk about the things going on with the brain and the spinal cord, let's jump over to, because we're going to be talking about this in this presentation, okay, that we have coming out here this week yet, okay, and we're talking about persistent or sudden onset of headaches, okay. Excuse me. We're talking about demyelination. Now, we've been talking about osteoporosis of the skull, which is the bone issue, but demyelination is the loss of the myelin, okay, insulation material in the brain and the spinal cord. And we're talking about Alzheimer's disease, Parkinson's disease. There's 90,000 new cases of Parkinson's disease diagnosed each year in America alone. 90,000 new cases each year, okay? And that's due to demyelination of the brain, because it doesn't happen uniformly all over the brain and the spinal cord. It sort of jumps around, and one person may have it in one area, and then somebody in her family in another state has it in another area, okay? So Alzheimer's disease, Parkinson's disease, multiple sclerosis, which we're going to talk about again some more later, MS, amyotrophic lateral sclerosis, ALS, Huntington's chorea, frontotemporal dementia, which is kind of a Alzheimer's disease that's found on the frontal part of the brain and the temples, as opposed to the entire brain, which you find in Alzheimer's disease. Okay, Bell's palsy, cervical spondylosis, optic neuralgia. I've got 50 more of these. We're not going to go into all those, but you understand what we're talking about here. All these diseases are caused by osteoporosis of the skull, and also of a loss of the myelin in the brain. And that's because 100 years ago, I hope everybody's sitting down here, 100 years ago, medical doctors said, look, you have heart disease, you have blockages in your arteries because you're eating cholesterol. You must stop eating cholesterol. I'm going to give you a prescription. You take this prescription and it'll lower your cholesterol levels in your blood. And suddenly now we get all these diseases that we didn't have before. Vision loss, muscle weakness, muscle stiffness, loss of coordination, walking problems, change in sensations, changes in bladder and bowel function, nerve pain, overall fatigue, uncontrolled body movement, difficulty in swallowing, changes in speech, mood, depression, anxiety, irritability. You're going to all these different specialists. It's just very simple nutritional deficiency, okay? And also caused by demyelination, because myelin, white matter in the brain and spinal cord, and the covering of the large nerves of the body, is made from cholesterol. So doctors created this disease by getting people off of cholesterol and giving them prescriptions to lower their cholesterol. When you get things going on with the fats you eat, frying and so forth, this causes inflammation in the arteries of the brain and the heart, and that's what causes the changes in the arteries in the brain and the heart. Okay, it's not cholesterol. Cholesterol is changed by your liver. Okay, it's changed by your liver to make myelin for the brain and spinal cord and the larger nerves. Okay, I always found that just fascinating. Okay, so we have some work to do. So people are okay. Here's some more neurological diseases. Alzheimer's disease, we already talked about Parkinson's disease, multiple sclerosis, cervical spondylosis, which is the neck, carpal tunnel syndrome, brain or spinal cord tumors. This goes on and on and on and on. Okay, neuropathies. Okay, chronic inflammatory demyelination. And this is why we have the I-26. We came out with the I-26, which is the raw materials for your brain to make myelin. And so you want to be using I-26. I like the chewables, come in chewables. I like the French vanilla soft chewables. Okay. They also come in what's a chocolate.
Banana coconut, doctor.
Oh, banana. There you go.
If it was chocolate, I would be all over it. But no, it's banana coconut.
Banana coconut. Okay. That's another one of the chewables. And then we have, of course, the powder and the pills. But I like the chewables because I can put them in my pocket and take them with me and don't have to carry another bottle with me in my pocket or something like that. But it rebuilds. I don't care if you've had Alzheimer's disease for 20 years. I've seen it go in 20 days because your brain will take this material, okay, these I-26, and turn it into the myelin for your brain and your spinal cord. I have seen so many miracles. And of course, they're in this book. It's all in your head in the CDs. And so it's one of those things where these are situations which doctors have no clue. Medical doctors have no clue. You ask a doctor, what is the raw materials for your body to make myelin in the brain? They'll kind of say, they don't know that it's cholesterol. And you stop their patients from eating cholesterol, you give them drugs to lower their cholesterol, they're going to get a demyelinating disease of the brain. And of course, we're talking about Alzheimer's disease and we're talking about all these things. It's one of those things where it's so simple, it's scary. It's so simple and scary. Okay. And so with that, did you have any questions, Rebecca, or any input?
So Dr. Wallach, I just wanted to point out a couple things that you had mentioned. Okay. So we're talking about mental health, which has to do with the brain. Okay. It also has to do with the nutrition that we put in our body.
Right.
But you had mentioned osteoporosis of the skull, which then that affects the 12 cranial nerves.
Yeah, it squeezes the nerves in the spinal cord.
And that squeezing of the nerves in the spinal cord, how then does that affect mental health?
Well, when you have the nerves that are controlling the brain's ability to decipher language or to make a good opinion of something when they get a handful of information, the brain does that if all the pieces are there. So if you're short circuiting because you don't have the myelin in the brain, which is the insulation material, okay, for every cell in the brain, it's one of those things where it's kind of like when you're short circuiting a TV or you're short circuiting a computer. It doesn't work right. Same way with your brain and your spinal cord. It doesn't work right when you don't have all the raw materials you need to make the myelin in the brain, in the spinal cord, in the nerve coverings and so forth. And we're talking about, people, they go to a podiatrist because they're having terrible, terrible pain in their feet. But it's osteoporosis of the skull, squeezing the spinal cord. And if you look at this book, it's all in your head, okay? And one of my favorite pictures in here tells a big story, okay? And this picture is, which I say, it goes along with the anatomy of the brain and the nerves.
Talking about this picture, Doc?
Yeah, there you go. There you go. That picture, you notice that the spinal cord starts at the brain, goes all the way down to the pelvis and splits. And then you get one big nerve going down the left leg, another big nerve going down the right leg, all the way down to your toes. So you're going to have something going on in your head, like you have osteoporosis of the skull, squeezing the spinal cord. You're going to feel it in your toes. And you go to, an orthopedic surgeon, and he wants to cut your toes off or give you an artificial leg and all this kind of stuff. It was really just osteoporosis of the skull, squeezing the spinal cord here. Or maybe even lower, maybe, where the spinal cord divides into the right and left. Okay.
Okay. My next question, Dr. Wallach, in relation to that is with the osteoporosis of the skull, it's squeezing those cranial nerves. How does the myelin sheath play into that protects the brain and the nerves?
Well, the myelin sheath is actually a buffer against pressure, buffer against irritation from the outside. And it's kind of like, if you want to help your hands, if you're doing a lot of work with your hands, you put on gloves to shelter your skin and buffer pressure and all that kind of stuff. Same principle here. And so when you rebuild the myelin in your brain, suddenly now that myelin rebuilds in the places where it's important, like in the spinal cord and the peripheral nerves and everything like that. And so it's protecting the nerves from that, from bone pressure, from naked bones pushing the naked nerves. That doesn't work. Okay.
So then the effect is kind of like if you have wiring in your house that have insulation that's missing and they touch something else, it could cause a short circuit,
It can cause a short circuit. It can cause a fire, all kinds of
electrical
things.
impulses,
Mhm.
pain, referred somewhere else.
Yes, exactly.
All right. Well, there's a lot of information, and I have emails that come in and say, well, Dr. Wallach says everything is osteoporosis. Well, not everything is osteoporosis, but folks, when you look at the list of the things that are kind of almost married together when it comes to osteoporosis, neurological conditions, demyelination, there are so many things that overlap that are some of the leading diseases that affect us as humanity around the world. And it all comes down to nutritional deficiencies.
Yeah. Well, here, let me interrupt here, if I may. That's very good. And of course, the medical system makes their living by relieving symptoms very quickly. I just
Mhm.
love my doctor. I had pain for 10 years and he gave me this new drug that just came out. And boy, in 3 days, that pain went away. I'm so happy. Then they died 2 years later because they didn't resolve the problem. They just relieved the symptom. Okay. And so, when you look at arthritis and osteoporosis, we're spending $7 trillion a year, $7 trillion a year to treat the symptoms of osteoporosis and arthritis, okay, in human beings. $7 trillion, okay, just to treat the symptoms each year. That's yearly, okay. And so this is because doctors treat the symptoms. And it's one of those things where when you look at the 12 pairs of cranial nerves, again, it's this book in the CD, it's all in your head, okay? You lose your sense of smell. Your optic nerve can get squeezed and you slowly lose your vision. Optic nerve is one of those nerves that has a lot of myelin around the nerve to protect it. And if you're not eating right, okay, if you're not eating all your 90 essential nutrients and you're not eating your um, proper fatty acids and everything, so you can make your myelin, okay, the optic nerve gets squeezed and you have all kinds of problems. The pupil, you cannot respond to the light. Double vision, trigeminal neuralgia, terrible pain in the face. It is painful. Double vision, Bell's palsy where one side of your face droops. Tinnitus, ringing in the ears and deafness. I get calls all the time about tinnitus and ringing in the ears. And, what can I say? It's the eighth cranial nerve being squeezed by the bone when you have osteoporosis of the skull. And doctors want to give you hearing aids and do surgery and all this kind of stuff. But if you do, okay, if you do what you're supposed to do, okay, and you take all your 90 essential nutrients and then throw in the I-26, stay away from the bad foods. That's very important to stay away from the bad foods because it interferes with the myelin function and production. Okay, loss of the gag reflex, okay, gastroparesis, COPD, that's terrible stomach problems. Let's see here, hiccups, atrial fibrillation, all cranial nerve number 10, cranial nerve number 11, loss of the trapezius muscle ability to reach up. And it goes on and on and on and on. I just really get weirded out by the simplicity of this, and the doctors don't even want to pay attention to it. Okay, so with this report that's coming out that Rebecca's been working on day and night to get finished, okay, this is going to cover, remember, the raw material to make myelin for your brain and spinal cord and your big nerves. The raw material is cholesterol. The raw material is cholesterol to make your brain. Okay. Now, so when you turn the cholesterol into myelin, you can prevent and reverse Alzheimer's disease. You can prevent and reverse Parkinson's disease. You can prevent and reverse multiple sclerosis. You can prevent and reverse ALS, which is amyotrophic lateral sclerosis. You can prevent and reverse Huntington's chorea, frontotemporal dementia, Bell's palsy, cervical spondylosis, optic neuritis, Charcot-Marie tooth, Guillain-Barré syndrome, neuromyelitis optica, myelin oligodendrite disorders, transverse myelitis, disseminated encephalomyelitis, okay? And myelitis is inflammation and our loss of the myelin, okay? Neuropathies, chronic inflammatory demyelinating, there goes that myelin again, polyneuropathies, because the nerves short circuit when they don't have the insulation material called myelin. Okay, and the myelin is made from cholesterol, which turns into myelin. So you have to be.
Dr. Wallach, neuropathy is another one we get a lot of emails about, and that has to do with the myelin as well, that's protecting the
Yes,
nerves.
yes, the myelin protects the nerves, especially the big ones. You know, your spinal cord and all the big nerves coming off in your shoulders and your legs and so forth, and your lungs and so on. All those big nerves are covered with a myelin sheath, insulates them. Okay, and so just amazing that the doctors have never figured this out. Okay, myelopathy, which is just inflammation of the myelin, optic neuropathy. Okay, progressive inflammation neuropathy. All these things have to do with myelin. And so I cannot, which they say, thank the team enough, because when the set comes out, okay, which is a printed page, okay, pages printed, but
Dr.
then
Wallach,
you also have an audio, right?
there's a full video, Dr. Wallach,
Oh, it's a full video.
full video.
Okay, so
Yes.
so it's a full video and a printed pages, correct?
There is some text that goes with it as well, yes. So depending on how you like to receive your information, we'll have transcripts or we'll have the actual video or we'll have both. But that's something that I'm working on, Dr. Wallach, and you're just putting more pressure on, and we have lots of hands up. But I do have one last question when it comes to the cholesterol and the myelin sheath. Are humans the only ones, Dr. Wallach, that require cholesterol for good health?
Oh no, all mammals do, whether they're an elephant or a seal or a whale or a
A
rabbit,
dog, a cat?
dogs, cats. Yeah. And so this is why um, um, carnivores, animals that eat other animals, eat the fats and everything, they have less cholesterol deficiency diseases.
You
Okay.
mean they don't cut the fats off their meat?
No. And so,
Oh, goodness. Then that's something, folks, whenever I go shopping for meat, especially, I don't want something that has all the fat cut off. I do want something that is range fed, no GMOs. Um, it we want to as close to nature as absolutely possible without being pumped full of hormones, without being pumped full of antibiotics. Because folks, you get that into the animal that you're taking the food from, it's in the tissues and then comes into our bodies. And how can you not expect it to not affect us as well?
yeah, let me interrupt there. And here's where the liver comes in. The liver converts the cholesterol into myelin. The liver converts cholesterol into myelin. That's one of its 50 jobs. Okay. So you want to keep your liver health up with all your 90 essential nutrients. And it's, again, one of those things. There's certain peoples, because of their diet, they have a very, very low rate of cholesterol and myelin deficiency diseases. And we're talking about cultures that eat the brains and the spinal cords of the animals they butcher. Okay, I can remember on the farm we used to eat the brains and the spinal cords of the cattle we would butcher. We didn't throw it away or give it to the dogs.
How about fish, Dr. Wallach? For those that don't like eat red meat and they prefer to do more of the fish, are there good fats in the fish that help support the the cholesterol levels and the liver as well?
Absolutely. Fish are one of the prime protein and healthy fat sources in the world. Fish. Okay, it's a universal. It can be either wild game, or they can have aquariums that they have, or ponds that they grow fish in, and so forth. But fish are famous in the old Bible as a diet. Okay, and so it's not like it's anything new. Certainly, fish will convert grasshoppers into healthy tissues that you can eat and get a lot of the stuff you need.
Well, I know some fish have more or higher essential fatty acids and fat and protein content than other fish. I prefer wild caught because then they're out in the nature eating what God provided instead of being, fed this pellets that are full of gluten and fillers. Dr. Wallach.
Mm-hmm.
Pretty scary what they put in animal feed, dog food, cat food, fish food, that is not what our body is intended to have.
Yes, well,
So
that's a different thing because they're coming up with a cheap diet that will give them
wait,
something to survive, as opposed to in a place where you're trying to grow the fish to sell as a food.
yeah, so wild caught over farm raised would be the preference here, right?
Yes.
All right. Well, Dr. Wallach, thank you so much for that great introduction in regards to mental health and how the nerves, the myelin sheath, all of that affects our ability to function both mentally and physically, and it's all connected.
And let me
Did you
say
have
one
something?
more thing here. We've done something very unique. We have identified the laboratory animal for these myelin deficiency diseases. Okay, and that's all part of the um,
All part of the project that I am working on.
that's right, all
Yes.
part of the printed page and all part of the video. Okay, and so
Um,
when you see the laboratory animals, I mean, we're tired of using rabbits and rats and guinea pigs and mice and so forth. So we came up with a whole new bunch of laboratory animals, and it's going to blow your mind.
yes. Well, Dr. Wallach, we have hands up, so we want to make sure that we get you as many questions as absolutely possible here, as we only have about 15 minutes left in the program. And I would like to first let everybody know that the content of this program is not meant to take the place of your primary care physician, nor are the products mentioned intended to treat, diagnose, or cure any diseases. But folks, the organization that requires us to say that, Dr. Wallach and his attorney, Jonathan E. Mord, have sued that entity 9 times and won. That those victories forced the different food manufacturers to make sure that nutrients were in the food, especially for babies in their formula, and also mamas with in their prenatal vitamins, that then has greatly reduced and almost eliminated when they're taken properly, because we can't say eliminated if they're not taking it, and there's these things still show up. But folks, what we put in our body from before the time we start making babies to throughout life really has an impact on the health of not only our families, but our communities and around the world. So make sure that you get back with the person that shared this program with you. Even if you don't have any health concerns, ask them what you can get on that provides you the 90 essential nutrients that the body requires, not just to survive, but actually thrive. If there's no one to thank, give our call team a call at 855-949-3377. So Dr. Wallach, let's go to the first hand that is up, and Susan. Go ahead and unmute yourself. And how are you today?
I'm great. I'm great. Good to see you all. Hi, Doc. Good to see
Hey,
you.
thank you. How can we help you?
Well, the question that I had is, I work with a naturopathic doctor. He's actually in another country, And he has a patient who had a stroke after he had a bypass surgery. And he's on a tube, a PEG tube feeding system right now. He's 78. He's a male, obviously he, and I think he weighs about 185 pounds. And I know you've talked about tube feeding before, but it's been a while. But what would you suggest? He's got great family support, and I know sometimes doctors are very fussy. They control what goes in those things. But is there something that you could recommend to administer these nutrients via that tube feeding system?
I'm assuming you're talking about a tube that's going down the mouth, not IV, correct?
This is it's the system that goes into the stomach directly.
Okay, good. Okay, yeah, they can use the Healthy Brain and Heart Pack. Okay, 1 per 100 pounds of body weight. If they weigh like 80 to 90 pounds, 110 pounds, they can use a half a dose for the morning dose and a half a dose for the evening meal. Okay, and then for energy, if they want during the day, they can use our Rebound. Okay, these are all converted to either liquids, okay, or the powders can be added to the liquid that's going down the tubes. And so there's no reason. And also, they would want the I-26, okay, comes in powder, and so it's easy to put into liquids to go in the tubes. The I-26 is going to help, especially since they had a stroke or something like that. And let's see if we can help rebuild the brain with the Healthy Brain and Heart Pack, the I-26, and the Rebound. Okay.
So like with the like for example, in the Brain and Heart Pack with this Ultimate Selenium, we would just open that capsule up and just mix it in with that liquid.
Exactly. Put the powder in. Correct.
Powder in there. Okay. Okay, very good. All right. Thank you so much, Doc. I appreciate it.
You bet. Let us know how it goes. Give us a call every couple of weeks. Let us know how it's going.
Okie doke.
Thank you, Susan.
Thanks, Doc.
All right. Thank you, Susan and Dr. Wallach. Let's go right over to Greg. Greg, go ahead and unmute yourself.
Hi, Doc.
Yes, sir.
Hi, Becca. How you doing today?
Fantastic.
Sorry, still having trouble with my video, but I can still hear and see and talk to you. So, I have a pregnant young lady that's 34 years old that had a previous pregnancy where her water broke prematurely, and I was wondering if there's a deficiency that would possibly cause that. We can add nutrients to keep her from having that problem again.
Well, she needs 1 Healthy Brain and Heart Pack per 100 pounds of body weight. She's consuming nutrients for 2 people, 1 in her embryo, 1 for her and 1 for the embryo, right? So she needs 1 Healthy Brain and Heart Pack per 100 pounds of body weight. And she can take she only weighs 110 pounds. She can take a half a dose twice a day. If she weighs 160 pounds, she can take 2 Healthy Brain and Heart Packs, full dose at breakfast, full dose at dinner time. And then for energy during the day, I mean, even pregnant women need energy, so they take the Rebound, a sports drink. Okay.
Okay.
Stay away from the bad foods. Fried foods, processed meats, oils, glutens, wheat, butter, oats, buckwheat, sugar, carbonated drinks, even the diet one's got to go. And the embryo will be blessed to get all this nutrition and to, have been avoiding the bad foods.
Okay.
Okay.
All right, Doc.
Let us know how everything's going.
Thank you so much. Appreciate it.
You bet. We appreciate what you're doing. God bless you.
All right. Thank you so much, Greg. And let's go to AJ. Go ahead and unmute. And then we'll have one more after that, Doc.
Okay.
Hey, Dr. Wallach.
Yes, sir.
How are you today?
Fabulous. I'm excited because we got this project coming out. I mean, I've been breathless over this. We worked on this. We worked on this one project since the 1960s.
Wow. Yeah, you guys, you do amazing work, Doc. That's why we're here.
Well, thank you. What's up?
Got this great young man named Timmy, and he's about 6 foot, about 175 pounds, 38 years old. He's a great guy. He's a fisherman. He coaches kids, has coached kids in the past, but he's dealing with a progressive form of MS. And, it's hard for him to get into the boat to do the fishing and things to that nature, but he doesn't quit, and we want to give him some help.
Okay, so let's get him off all the bad foods. And at 175 pounds, he needs 2 healthy brain and heart packs per month, a full dose of everything twice a day. He also needs the I-26. I give him 3 doses a day. I take 2 doses a day. I like the chewables, and we have the pills, we have the powder, and we have the chewables. Okay, and the I-26 will rebuild the myelin. When you have MS, it's a demyelinating disease, multiple sclerosis. Okay, and the scar tissue is replacing the myelin. Okay, and so there's all this short circuiting going on in the brain and the spinal cord and so forth. This is all reversible. Okay, get off all the bad foods to stop progressive damage, and then you get them on the healthy brain and heart pack, appropriate for body weight, and then throw in the I-26. I just get excited about this. Okay, and he can also use the rebound or sports drink.
Thank you, Doc.
You bet. Keep us informed on this, will you, AJ?
We'll do, sir. Thank you.
You bet. God bless. Keep up the great work.
All right. Thank you, AJ. And next, let's go to Laura. Laura, go ahead and unmute yourself.
Good afternoon. Hi, Dr. Wallach.
Hi.
Hi, I'm thrilled to be able to talk to you, and I promise I'll be brief here. I have a number of issues. I have seasonal allergies. I've had them most of my adult life, and they're just getting worse, getting longer durations, so not so much seasonal anymore. With that, I have chronic dry eye, and I'm developing some food sensitivities. I also get heart palpitations. They got worse after I got COVID last spring. And lastly, I suffer from anxiety. I want to start your program, but I don't know where to start.
Okay. You start by getting rid of the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, no brown rice, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. And let's see here. How much do you weigh?
About 150.
Okay, 150. I want you to have 2 healthy brain and heart packs per month. Take a full dose of everything twice a day. I want you to take the I-26. Go ahead and take 2 or 3 doses a day. I want you to, let's see here. Go ahead and take our hair, skin, and nails. Okay, for the skin issues and hair issues and so forth, as the name implies. And then, because of the palpitations, I also want you to have the, let's see, Cardio FX. Cardio FX, go ahead and take 3 of those twice a day. Cardio FX. And let's see here. I would also take the Ultimate Daily Classic tablets. Ultimate Daily Classic tablets. Take 3 of those twice a day. That's going to support healthy blood pressure and healthy blood flow, even through partially blocked arteries and veins. Okay.
Okay.
And then if you have anything going on, you can actually, don't forget the rebound, or okay, don't forget the rebound. You can also just rub the plant minerals on your back and your hips and your neck and your arms, your shoulders, and so forth. You'll absorb it that way. Okay.
When you say the plant minerals, are you talking about like the tangy tangerine or?
No, I'm talking about just a bottle of plant minerals.
Oh, okay.
They come in a bottle like that. Yep, Doc's
Okay.
got one too. And you
Okay.
can take it and put it in a spray bottle and just spritz it on your chest, on your abdomen, your back, on your legs, and absorbed right into the skin, right into the bloodstream as well.
Okay. And
Yeah, that's how we helped Pastor Mike 10 years ago. And he was ready to die after 2.5 months almost 3 months of being in a coma, and the doctors gave up on him. We're pulling all the plugs and everything. And Linda Tyler just rubbed the minerals on him 3 times a day. And the next day, just like 12 hours later, he wakes up perfectly normal.
wow. Okay. I had ordered the tangy tangerine minerals and vitamins. Should I be doing that as well? Or
Well,
I
you're
mean,
gonna,
I do have a budget constraint here, but
well, that's why the Healthy Brain and Heart Pack covers all that. So you don't have to get 50 different bottles, and
okay.
it simplifies things. Okay.
Okay.
And so if you have to start out with one Healthy Brain and Heart Pack for finances, start out with that and take a half of those for your breakfast, half of those at dinner time. But at 150 pounds, dose wise, you want 2 Healthy Brain and Heart Packs per month. And take a full dose of everything twice a day. And
Okay.
then don't forget the Ultimate Daily Classic tablets. And let's see here, don't forget the Cardio FX and the hair, skin, and nails. Okay.
Okay. Thank you very much.
You bet.
All
Thank
right.
you.
Thank
Keep
you,
us
Laura.
informed.
Yeah, I will. And I'll be back later. I have questions about my cat, but I'll save that for another time.
Okay.
Okay.
All right.
Thank you.
Thank you so much. And Dr. Wallach, we do need to keep you on your schedule. So thank you so much for joining us here on Daily with Doc, Dr. Wallach. You are an inspiration as you keep going and keep helping everybody and try to get as many people in as possible throughout your day, every day.
Well,
So
thank you,
thank
Becca.
you, Doc.
Thank you, team. Thank you, Becca. Thank you, team. We're so proud of each and every one of you for participating and getting the information out and helping people. You're angels of God, and we love you all. Thank you so much.
Yes, thank you, Doc. And for those of you who would like to get Dr. Wallach's books, you can go to drjwallach.com. That's drjwallach.com. And I do apologize, we had some more hands up, but we are at the end of the time frame that we have for our show. If I could get my co-hosts on the screen with me, we could not do this without them and all their support. For those of you who are here live in the Zoom with us, I know that you have enjoyed being able to see all of the information that is shared in the chat. And we have Sherry and Marilyn and Phyllis, all three of them, adding information in there and also keeping track of everything that's going on all of the different streams, which AJ is making sure those streams stay connected and rolling smoothly. And we have Albert who's helping keep an eye on the cameras and the chat and letting people in. So folks, it takes many hands to make light work, right? And I am so thankful for this group of people who help do that. And they have skills that they have brought to the team that to go beyond what this Zoom does. And if you have skills that you would like to contribute to helping promote the story and the message that Dr. Wallach has put together on this crusade to save humanity and the world, make sure that you get back with the person that shared this program with you. They cared enough about you or thought of you and the impact that you also can make on your community so that together we can make an impact around the world in helping folks find underlying causes, addressing those underlying causes, and eliminating so many of the things that are going on in our lives that don't have to be. They don't have to be. And folks, prevention is so much more affordable than reaction. Just keep that in mind. So even if you are doing fantastic, you want to make sure that you maintain doing fantastic by incorporating the good foods, bad foods list. As I mentioned, that is on our website, DailywithDoc.com. And also getting the 90 essential nutrients. So get back with the person that shared this program with you. Say, hey, I want the 90 essential nutrients plus whatever's needed for whatever condition you are looking to address. And remember, the products themselves don't prevent, cure anything, but the nutrients that have been formulated together synergistically within them, the body is able to do some amazing things with. And that is something that I'm super excited about because of what it did within me. Folks, have a fabulous day. Thank you for joining us here on Daily with Doc. And we look forward to having you here live in our Zoom room by going to dailywithdoczoom.com Monday, Thursday, Friday from 12 to 12:50-ish p.m. Pacific time. Until next time. Oh, don't forget, if you share our program, we have a giveaway that's going to send you thank you gifts from me for sharing the program and getting this message out. So go to DWD giveaways, DWDgiveaway.com. Bye for now.